Good morning, everyone. Today, I'd like to talk about the effects of non-antibiotic drugs on the microbiome and overall health. Most people know that antibiotics have adverse effects on the gut microbiome. Most people also know how important the microbiome is for overall health. Now, the microbiome is the collection of organisms, bacteria, fungus, even viruses that work synergistically with our body to influence physiology and health. The billions of organisms that live in your gut help you to digest food, they help you to absorb nutrients, they create nutrients themselves that your body ends up using. They also provide immune function by preventing other abnormal or bad bacteria, viruses, and parasites from taking hold of your body. So they provide a level of protection. And they also help to create and influence sex hormones. They help to create and influence neural hormones. So your brain chemistry. Most people don't realize that a certain amount, quite a bit of amount of dopamine and serotonin actually comes from our digestive system, not our brain. In short, the gut is a very important system to optimize our health, and anything that negatively impacts the organisms that make up your gut is going to negatively impact your health. But did you know that nearly a quarter of non-antibiotic drugs impact your gut as well? Yes, there are a number of prescriptions that people are taking, including over-the-counter prescriptions, that could absolutely be influencing your gut in a negative way. So not for better. Because the health of our microbiome is so important, I would always question, or at least think twice about taking antibiotics. It kills me whenever I hear of a child that goes to a pediatrician because the child's not feeling well. Without any kind of investigation, they just quickly dish out an antibiotic for that child, not even knowing whether that child has a bacterial infection or not, just simply based on symptoms alone. The American Academy of Pediatric Physicians, over almost 10 years ago, came out stating that we are massively over-prescribing antibiotics for this reason. In other words, if you give somebody an antibiotic and they don't have a bacterial infection, you are creating way more harm than good, right? So very important to really be thinking twice about these things. Now, thanks to more widespread appreciation of the gut microbiome, more and more patients and doctors are now understanding the potential negative impacts of antibiotics on healthy bacteria. However, a study published in the journal Nature suggests that many non-antibiotic drugs can also affect our microbiome in a negative way. First, the interaction of drugs and the microbiome is not a new concept. It's been known for quite some time that microbes influence the efficacy and toxicity of drugs. And several studies had previously found that compounds like metformin, PPIs, proton pump inhibitors, omeprazole, anything for reflux, right? The purple pill, NSAIDs, non-steroidal anti-inflammatory drugs, and atypical antipsychotics can all alter the composition of the microbiome. And it is well understood that, again, these compounds may be having their effect in our body because of the way that they impact our microbiome. Now, the goal of this study, published in Nature, was to systematically profile interactions between drugs and individual gut microbes. It was titled Extensive Impact of Non-Antibiotic Drugs on the Human Gut Bacteria. They tested 1,079 pharmaceuticals that are commonly administered to humans. This included 835 with targets to human cells, 156 with antibacterial activity, 144 antibiotics, and 12 antiseptics. Unsurprisingly, many of the antimicrobials or bacterials tested had broad spectrum activity, meaning that they inhibited pathogenic bacteria, but they also inhibited commensal bacteria, the good bacteria, which is what you don't want. And this is why it's important to remember that all medications, over the counter or prescribed, come with a certain amount of collateral damage. Of the 156 antibacterials tested, 78% were active against at least one commensal species, and most had activity against potentially beneficial microbes. So again, that's a big number of compounds that people are taking that is negatively impacting their gut microbiome, which of course influences so many different systems of the body. Additionally, 47 of the 88 antifungals, antivirals, and antiparasitics had anti-commensal activity. The most novel finding, though, was that 203 out of the 835 human-targeted non-antibiotic drugs showed activity against normal gut microbes. Again, that's a very big number. Almost a quarter, 24% of non-antibiotic drugs having a significant impact on the gut microbiome. Now, how many people out there have a certain level of IBS, have digestive issues, have bloating? How many of them have nutritional deficiencies, have inflammation, unresolved inflammation? How many people out there have no idea why they can't balance their hormones because it's all stemming back to gut dysfunctions? And how many of that gut dysfunctions are related back to years of taking over-the-counters, prescription drugs that we never thought might be, causing issues? Many of these medications included things like cancer therapies, anti-inflammatories. So anytime you get a muscle relaxant, anytime you get something to reduce inflammation for arthritis or osteoarthritis, over-the-counter NSAIDs, ibuprofen, Tylenol, naproxen, proton pump inhibitors, omeprazole, like I said, the purple pill, anything for reflux, anti-diabetic medications like metformin, antidepressants, antipsychotics, drugs for lowering blood pressure, hormone modulators, which, some women are given in their teens. Some women and a lot of men are now taking this to try to correct for their hormone imbalances. And then, of course, antihistamines, which I'm going to talk about here in a little bit. Now, one interesting statement from the lead author, Dr. Peer Bork, said that this shift in the composition of our gut bacteria contributes to drug side effects, but might also be part of the drug's beneficial action. I think that's pretty interesting. In other words, your prescription might only be working because it's changing your gut microbiome. For example, metformin, a drug commonly used to treat diabetes, has been shown to alter the gut microbiome, increasing the abundance of beneficial microbiomes, such as Akkermansia, Butyrovibrio, and Bifidobacterium. Now, those off-target effects on the microbiome suggest that treating one disease with a pill could potentially be causing another disease down the road. In other words, taking a proton pump inhibitor for your acid indigestion or reflux might help control your reflux now in the short term, but it will also cause a shift in your gut microbiome that predisposes you to things like IBS, irritable bowel syndrome, gut infections, liver disease, and other conditions. Finally, because I live in Austin and because the trees right now are having a sex party, which, basically all the pollen is everywhere, right now, all over the place, causing allergies for people, I'd like to share some additional information from an interventional RCT or randomized control trial of using histamine blockers, such as Allegra, Pepcid, all of your antihistamine or allergy over-the-counter medications. In a paper published in the journal Science Advances, a group of researchers describe two experiments conducted, one short range and the other long range, that involved giving volunteers antihistamines before they engaged in exercise regimens. Histamine is a chemical produced by the body for many reasons. One of it is to help regulate blood flow in muscles, particularly after they're stressed due to exercise. So histamine is actually considered a vasodilator. What that means is that when histamine is released in your body, it opens blood vessels up. Now, when you have a rapid release when there's a lot of histamine and you have a rapid opening of blood vessels, it can cause itchiness. You're going to get a certain number of symptoms. Think of this kind of like when somebody gets a virus and their body, not the virus, their body increases their body temperature as a way to fight that virus. That's why you have a fever, right? It's your immune system fighting that virus. What do people do? They take fever reducers. They purposely blunt their immune response so they don't have a fever. It doesn't make sense. So when we're having an immune response to histamine, what do people do? They take antihistamines. They're blocking the immune response. Again, the histamine opens blood vessels up. The increase in blood flow helps to repair and build more muscle. It's a very important part of the process. In this new effort, the researchers wondered what might happen if histamine production was blocked before, during, or after exercise. Well, to find out, they carried out two experiments. The first was a single session. The second, again, was conducted over several weeks. And the researchers found that blocking histamine in the first group resulted in less of an increase in blood flow to the muscles during exercise. In the longer experiment, the researchers found that those who were given the antihistamines experienced very little improvement in exercise efficiency, blood flow, or muscle growth. Measuring insulin sensitivity, your ability to regulate glucose and your ability to build muscle, or the ability for cells to use insulin. Measuring vascular function, they measured blood flow. They measured aerobic capacity in these individuals. And they also did muscle biopsies where they were literally looking at the mitochondria, the powerhouses of our cells. The researchers found that antihistamines impacted insulin sensitivity, aerobic capacity, and the ability to recover and build muscle in a negative way. All that said, while pharmaceuticals can be a valuable tool in the management of disease, this information should be a reminder that if we can address the root causes of disease and support a healthy gut, we're much more likely to achieve lasting long-term health in a better way without collateral damage. As always, I hope you find this information useful. And now go out and do good things.